Okay, let's dive in.
Mhm.
Imagine you're looking at a blood sample, right,
Right?
under the microscope,
Mm-hmm.
and you see these white blood cells,
Yep.
but the nuclei, they just look odd, kind of
Yeah.
blobby, not segmented like you'd expect.
Right. Undersegmented.
Exactly. And then your first thought is probably, whoa, big problem, serious infection. But what if? What if it's actually not sickness? What if it's just genetic?
Yeah. What if it's just how those cells are built?
Welcome to the deep dive. Today we're exploring Pelger-Huët anomaly in animals based on the materials you share, the research, the notes.
Good stuff in there.
Our goal is to really unpack this. What is it? What does it look like? Who gets it? And maybe most importantly, why knowing about it is so crucial to avoid, well, a potentially big diagnostic mix-up.
Absolutely. Because mistaking this for something serious, that's the real danger here. It's all about that microscopic difference.
Getting that difference right is key.
Mm-hmm.
So let's start right there. What exactly is Pelger-Huët anomaly when you're looking through that microscope?
Okay, so fundamentally, it's an inherited condition, congenital. The main thing you see is what's called nuclear hyposegmentation.
Hyposegmentation, meaning less segmented.
Exactly. In the granulocytes, your neutrophils, eosinophils, basophils, the nucleus doesn't divide into the usual lobes. It might look round or oval, maybe sort of peanut-shaped or like a dumbbell.
Okay.
And it can affect monocytes and megakaryocytes too. They can also show less lobulation than normal.
So the shape looks, well, it looks less mature, doesn't it? Like
Oh,
the nucleus didn't quite finish developing.
precisely. And that's the trap, because immature white cells, the ones released when there's bad inflammation, also have less segmented nuclei.
Ah, okay. So how do you tell them apart? This sounds like where it gets tricky.
It is, but here's the absolute key thing, the critical point from your sources.
Hmm.
Even though the shape looks immature, the chromatin inside that nucleus is mature.
The chromatin, the genetic material packaging.
Right. It's condensed, clumped, dense. It stains normally or even darker, what we call normochromatic or hyperchromatic. That's completely different from the chromatin in a truly immature cell, which is fine, open, paler.
Okay, so the shape is misleading, but the chromatin gives away its real age and maturity. Like it's got adult insides, even if the outside looks a bit unfinished.
That's a great way to put it. The chromatin pattern is your number one clue. And there's another thing, the cytoplasm.
The rest of the cell goo.
In Pelger-Huët cells, the cytoplasm looks totally normal, completely unremarkable. You don't see those toxic changes, things like dull bodies or a blue foamy look or toxic granulation.
Which you would see if it was a real inflammatory response pushing out young cells.
Often, yes. Those toxic changes often go hand in hand with a serious left shift caused by inflammation or endotoxemia.
Okay, so the fingerprint is weird nucleus shape, but mature, dense chromatin and normal cytoplasm.
Got it. So how does an animal actually get this? You said inherited.
Correct.
Yeah.
The thinking is it follows an autosomal dominant pattern, meaning you only need one copy of the gene.
Generally, yes. Inheriting just one copy from a parent is usually enough to show the characteristic cell shapes. It's basically a genetic blip in the final stages of cell development, specifically how the nucleus segments.
Like a final instruction missing.
Sort of, yeah. A defect in terminal differentiation. In humans, there's a similar condition linked to a specific gene mutation, the laminin B receptor, and it's likely something comparable is happening in animals.
Interesting. Now you said generally autosomal dominant. Is there a catch?
Well, your materials did point out something interesting seen in Australian Shepherds specifically. Incomplete penetrance.
Meaning,
Meaning some Aussies might inherit the gene, but you don't actually see the typical cell changes under the microscope. The gene's there, but it's not fully switched on visually in every single case for that breed.
that adds a layer. So apart from Aussies, which animals tend to get this? Is it common?
Overall, it's considered pretty uncommon. It's been seen in lots of dog breeds, purebreds, and mixed breeds. But, like we said, for Australian Shepherds, the incidence reported in some studies is surprisingly high, like almost 10%.
Wow, 9.8% you mentioned. That's definitely something to keep in mind with that breed. What about cats?
Much rarer in cats, it seems. Mostly reported in domestic shorthairs, and likely way less common than in dogs overall.
Okay, so definitely more of a dog thing, especially watch out in Aussies. Now, the big question, does this weird cell shape actually make the animal sick?
And here's where it gets really important to distinguish. Animals that are heterozygous, the ones with just one copy of the gene, are typically completely fine, asymptomatic,
No symptoms at all.
none related to this anomaly. Their white blood cells, even with the funny shape, work perfectly normally. They fight infection, do their job. You'd likely only find it by chance on routine blood work.
So microscopically abnormal, but clinically totally healthy and functional.
Exactly. But
Okay.
there's a but. The homozygous animals, the ones unfortunate enough to inherit two copies of the gene, one from each parent.
Uh-oh.
Yeah, it's usually lethal. They often die before birth or are stillborn. And they frequently have severe skeletal problems like chondrodysplasia issues with cartilage and bone formation.
Wow. So one copy is a harmless quirk, two copies is devastating. That's a huge difference.
It really highlights the genetic dosage effect.
Okay, so this brings us right back to why recognizing the heterozygous form, the harmless one, is so incredibly important for you, the listener, looking at that blood smear.
Yeah.
What's the big risk if you don't recognize it?
The number one thing you absolutely cannot confuse it with is a severe left shift, either regenerative or degenerative.
Remind us what a left shift signifies again. Why is that so bad?
A left shift means the body is in serious trouble, severe inflammation, infection, maybe endotoxemia. The bone marrow is desperately pumping out immature white blood cells like banned neutrophils, sometimes even earlier forms to fight whatever's going on.
And those immature cells also have less segmented nuclei, hence the confusion.
Exactly, that's the visual overlap. But a left shift means the animal is sick and needs urgent attention. Pelger-Huët means the animal is usually fine. Thinking them up is a big deal.
Okay, so let's nail this down. How do you reliably tell the difference when you're looking down that microscope?
Right, you need to combine the visual clues with the clinical picture. First, back to the chromatin. Pelger-Huët, mature, condensed, dark chromatin, left shift. Immature, open, pale, finer chromatin. That's your main visual cue.
Chromatin maturity is key. Got it.
What else? Second, the cytoplasm. Pelger-Huët looks normal, left shift. Often shows those toxic changes we talked about, dull bodies, blueness, toxic granulation, signs of cellular stress from inflammation.
Okay, so check the chromatin, check the cytoplasm.
And third, critically check the patient, the clinical status. Animals with Pelger-Huët are generally healthy, bright, alert. Animals with a severe left shift are typically sick. Fever, lethargy, signs of whatever disease is causing the inflammation.
Right. And their other lab work would probably reflect that sickness too.
Exactly. Things like serum chemistry or urinalysis might show abnormalities related to the illness in a left shift case. In uncomplicated Pelger-Huët, those other tests should be unremarkable.
So it's really a three-part check. Chromatin plus cytoplasm plus clinical health, mature chromatin, normal cytoplasm, healthy animal points strongly to Pelger-Huët.
Precisely. Immature chromatin, toxic cytoplasm, sick animal points strongly to a left shift. Using that framework helps you avoid misinterpretation.
And avoid unnecessary panic, tests, and treatments for the animal.
Absolutely.
And the sources were clear that once you've identified it based on these features, you generally don't need a ton of other complex tests for the anomaly itself.
Correct. The diagnosis is primarily morphological, made on the blood smear, ideally in context of a healthy animal with normal baseline labs. Things like advanced imaging or specialized genetic testing aren't typically needed for routine diagnosis, though confirming a hereditary pattern in related animals might be done, often more for academic or breeding purposes.
Okay, and let's say you diagnose an animal with the common heterozygous Pelger-Huët. Do you treat it?
Nope. According to the sources, no treatment is needed or indicated for the anomaly itself. The cells work fine, so there's nothing to fix.
And no special follow-up needed just for the Pelger-Huët.
None needed for the condition itself once it's identified.
Okay, let's pull this all together then. Pelger-Huët anomaly. It's this really interesting inherited quirk where white blood cells look funny shape-wise, but the absolute crucial takeaway for you is that in the heterozygous animals, the ones we actually see these cells work just fine.
Right, because the chromatin inside is mature, the cytoplasm is normal.
And knowing that and seeing the animal as clinically well, that's how you avoid mistaking this benign genetic trait for a dangerous left shift, which signals serious illness.
Making that distinction using chromatin, cytoplasm, and the clinical picture, that's the core skill here. It ensures you interpret that blood work accurately and make the right calls for the patient.
Understanding this one specific anomaly really sharpens your eye for detail when looking at blood cells, helps avoid confusion.
Definitely.
So based on all this, here's something to think about. Given that the common form of Pelger-Huët is asymptomatic, totally hidden unless someone does a careful blood smear review, how many animals out there might be walking around perfectly healthy carrying this gene showing these cell shapes, but nobody knows? Just because that specific microscopic exam hasn't been done, and maybe more broadly, what does that potential hidden prevalence tell us about all the other unseen genetic variations quietly existing within our animal populations?